would you like to introduce yourself and explain to us a little bit about your role?
I'm Judy Wilson, the Health Promotion Nurse here on campus, and I work at Student Health Services, which is our doctor's office on campus. We're on the second floor of the CAW Center in room 242. We usually have about 4 doctors working every day and 2 registered nurses and 2 medical secretaries. We have a psychiatrist who comes twice a week and a dietitian that comes once a month. We only see University of Windsor students. You have to be a student to come to our clinic here. And a lot of students get confused. They think that if they opt out of the drug plan, they can't come to see the doctor on campus. But what you need is your health card, your OHIP card or your Green Shield OHIP equivalent. Any students at the University of Windsor can come to see one of the doctors here. We don't see staff or neighbors. You have to be a student. Our foyer, which is right behind me, has literature. Students just can come in and browse the literature and take what they want. We also have a website that will be on the video at www.uwindsor.ca/health, and there's information and links to other health websites. So here we are in the treatment room as part of Student Health Services in the clinic, and when students come in and they're ill, this is one of the rooms that may come in. We can do asthma treatment or stitches or some minor surgeries we'll do here. And counseling usually is done in the doctor's offices more than in here, but it's kind of good to see what's available here on campus and in our clinic.
So in health services, what do you do to help students that are having difficulty with substance and alcohol use?
So substance and alcohol use is certainly an issue that we would see. A student could call and make an appointment to see one of the physicians, or they might be referred maybe from Student Counseling Center or the Peer Support Center to come and talk to one of the docs about it. Our physicians are counselors as well. They do a lot of counseling on many different issues, and they would work with the student in what might be the best plan for them. Okay. We also do some outreach work, and that's where I would go out and we do, with the alcohol team, we do all the varsity athletes to talk about alcohol and other drugs and things to be aware of. And any sanctioning, anyone who's sanctioned for alcohol infractions or drug infractions can go to the sanctioning sessions that we offer. But the other thing is the sessions that we provide are on the www.responsibledrinking.ca University of Windsor website, and those dates and times are there, and anyone that wants more information about alcohol can go to those just to see, are they in trouble, or are they going, are they possibly, what they're doing could lead up to problems related to alcohol, and also for students who just want some more information for themselves, for their friends, for a course. We also have in our community specialists in addictions, and so we also have referrals like to AA that someone may want to go to, or Al-Anon or Alateen, and also the Addiction Referral Resource Center through Windsor Regional Hospital. People can call and we'll give them the contact information and refer themselves if they have a concern, and that's where assessment will be done, and then where's the best place for that person to get the help that they need. It's not always AA, it's not always in-house, it may be something totally different, and that's our resource in the community. Another place to go is the Teen Health Center, which has addictions counselors right there for anyone who's under 24. And that's a great resource as well. As far as Student Health Services dealing with alcohol poisoning, that's a crisis situation where an ambulance will be called and a patient will be taken to the hospital. Occasionally, we are informed of that, and the patient does come back here, the student comes back to see us, so we can follow them to make sure there wasn't any kind of permanent liver damage, or and that the person gets some counseling, the appropriate counseling going on. But not all, we may not be aware of that. It certainly is a crisis when someone is so intoxicated that things are starting to shut down. They aren't breathing properly, they can't be roused. And that's the big one. If you can't rouse someone, you pinch them or shake them and you don't get any response, that person's in big trouble, and an ambulance has to be called right away.